Hello, and welcome back to our video series on pharmacology. In this video, we'll go over chapter number 23, Vaccine. Learning objectives for this chapter: identify the component parts of the body's immune response, describe the four types of immunity and how they function, describe the four types of vaccines, discuss how vaccines differ from immune globulin drugs, list some ingredients added to vaccines and describe what problems they might cause, describe the routes of administration used to give immunizations, describe the diseases that vaccines are used to treat and how they are used, and lastly, read and interpret standard childhood and adult immunization schedules. Alright, we'll start off first with the body's immune response. Now, the immune response is a coordinated effort between the blood and the lymphatic system to destroy microorganisms that invade the body. And any microorganism that causes a disease is known generically as a pathogen. Or patho means disease, and the suffix gen means that which produces. Okay, each type of pathogen has antigens. Now, your immune system identifies antigens as either being foreign to the body or being of yourself. And if it's foreign, then it'll be searched out and destroyed. So once a pathogen is detected, the body can attack it in several different ways. These can include white blood cells, or these can include antibodies. Some examples of white blood cells include neutrophils, and they engulf and destroy bacteria. And some bacteria, after they're destroyed, will release toxins that are damaging to body tissues. Another example of a white blood cell is a lymphocyte, and these will mainly attack viruses. And a specialized white blood cell called the NK cells, or natural killer cells, will recognize foreign cells before the body cell is coated with antibodies. Right, when it comes to lymphocytes, there are two broad kinds. There are the B lymphocytes, or B cells, and T lymphocytes, or T cells. And each one of those has their own subcategories depending on that cell's role in the immune response. Now, B cells are activated when a monocyte presents them with a fragment of a bacteria or a virus it has eaten. So these have to be presented with a part of the antigen before they know what they have to go out, look for, and to kill. A particular type of T cell called killer T cells, or cytotoxic T cells, will produce toxic granules that will kill cells that are already infected with a virus. This way they can't reproduce and release more viruses to the body. Memory T cells are inactive until the next time the virus they are exposed to enters the body. Another type of white blood cells are the monocytes, and these are the largest white blood cells. These will engulf and destroy bacteria and virus-infected cells that have been coated with antibodies. And monocytes also will produce interferon. Now, interferon will produce an antiviral substance that keeps viruses from entering other cells and from spreading throughout the body. And this will also stimulate natural killer cells to attack the virus-infected cells. Monocytes also will produce what's called tumor necrosis factor that will destroy endotoxins that are released from bacteria. And this tumor necrosis factor is what will initiate a cell killing itself, or apoptosis, if it becomes infected with a cancer. Another way that the body could respond to the presence of a pathogen is with antibodies. Antibodies are also known as immunoglobulins. Antibodies are produced by the B lymphocytes, and there are 5 different types of antibodies, and they will vary in their structure and their size and what particular types of pathogens they respond to. And we'll go over a few of the 5. The first one, immunoglobulin M, or IgM. This is produced the first time the body encounters a bacterium or a virus. Another kind is IgG, immunoglobulin G, and this is the most abundant type of antibody. This will provide for active immunity. And it's also capable of being passed from mother to fetus. So another type of antibodies is IgA, immunoglobulin A. This is found in body secretions, and also in mucous membranes and in colostrum. And the other 2 types that aren't listed here are IgE, immunoglobulin E, and IgD, immunoglobulin D. Alright, now we'll move on to talk about different types of immunity. And there are 4 main types of immunity. The first one we'll go over is natural immunity. This is the state of the body's own immune system being able to identify, attack, and destroy disease-causing pathogens. It's also known as your innate immune system. This is what you are born with. There's nothing you can do to enhance this. What you have is what you have. The other kind is acquired immunity. This will result from some type of exposure to a pathogen. So this is provoked by another source, either from a drug or a vaccine or from the mother of a fetus. There are multiple kinds of acquired immunity, depending on what provokes that exposure to that pathogen. First one we'll talk about is naturally acquired passive immunity. Now this occurs naturally when the fetus is still in the uterus. and this can extend during the first 18 or so months of life. And the antibodies that will get passed on here would be IgG antibodies. This can also be passed on from mother to newborn while breastfeeding. So the other type of acquired immunity is artificially acquired passive immunity. This is where you have an immune globulin drug given directly to a patient that's been exposed to a disease. The other types of acquired immunity, naturally acquired active immunity. This is after a normal exposure to a disease-causing pathogen. And this will begin whenever you're 18 months old and then beyond. So someone sits next to you and coughs, and they're sick, and they expose you to the flu that they have, you are naturally being exposed to a disease. And the last kind of acquired immunity is artificially acquired active immunity. And this is the basis of vaccines. And the point of this is to prevent disease from ever occurring in the patient. And if you notice, there's a pattern here between naturally acquired or artificially acquired, or active immunity or passive immunity. And those terms have very specific meanings. If an immunity is artificially acquired, you are being injected with something. So you're either being injected with a vaccine, or you're being injected with the antibodies directly. So you have to go to a doctor's office to get this done, or a clinic of some kind. Naturally acquired happens naturally, either a normal exposure to a disease, or from receiving the antibodies through a fetal circulation or through breastfeeding. Those are naturally occurring events. Differences between active and passive. Active immunity, you are making the antibodies yourself. When it's passive, you are given already made antibodies. So being injected with already pre-made antibodies would be passive immunity that's artificially acquired. A newborn breastfeeding is getting already made antibodies from their mother through the breast milk, through the colostrum. So that's a naturally occurring process, but you're getting pre-made antibodies, so that's a passive process. All right, now we'll move on and talk about vaccines. Now, vaccines are drugs that are produced and administered for the sole purpose of preventing the occurrence of a specific disease caused by a bacterium or a virus. All right, on this table we have a list of some very common pathogens for which there is a currently developed vaccine. Examples such as anthrax, diphtheria, hepatitis A and B, herpes, measles, mumps, polio, tetanus. So all these very, very common pathogens and very common vaccines. Now, vaccines will come in multiple forms. The first kind that we'll talk about is a live virus, or the bacteria or virus that causes the disease is very weakened. Another term for this is attenuated. So yes, the pathogen is alive, but in a very, very weak state. Now, the pathogen gets to this condition by being grown in several different types of cultures. And as that process happens, it gets weaker and weaker and weaker. It's also grown at temperatures that do not allow it to reproduce easily. And the whole point of doing both of these methods is to induce mutagenesis, or you are creating mutations within the bacterium or within the virus, in particular DNA or RNA mutations. So when the pathogen is in a weaker stage like this, it's going to be less virulent. See, another form of a vaccine is having the pathogen intact but inactivated or killed. And it would be killed with either with heat or with chemical. At this stage, because it's dead, of course it cannot reproduce. So the antigens on the outside surface of the bacteria can still provoke a response from the patient's immune system. See, another type of vaccine are subunits. And in these vaccines you have just the part that contains the antigen on the surface of the bacterium or the surface of the virus. So you don't need the full intact bacterium or the full intact virus, just the bit that you need. See, another form of vaccine are toxoids. And these contain only the toxin produced by certain gram-negative bacteria. And these toxins are inactivated by formaldehyde. It can no longer induce a fever or infection. All right, now we'll talk about polysaccharide versus conjugate vaccines. Now, a polysaccharide vaccine have carbohydrate molecules that are found in the walls that surround certain bacteria, but these do not provoke a strong immune response from the body. Conjugate vaccines, or joined vaccines, have a polysaccharide taken from the capsule around the bacterium that is joined to a protein carrier. An example of each one of these categories: the Hib vaccine, Haemophilus influenza type B, is a conjugate vaccine. It was first produced in 1987. And the pneumococcal pneumonia vaccine is a polysaccharide vaccine. All right, when it comes to vaccines, one characteristic of them is valence. And valence is a reference to how many strains of a pathogen the vaccine contains. So for example, a monovalent vaccine contains only a single type of antigen, or a single strain of one pathogen. A trivalent vaccine contains three types, or three strains of a pathogen. A multivalent vaccine has several types, and this is true for most vaccines for the flu shot. For example, Gardasil is a quadrivalent vaccine, so it contains 4 different strains of HPV, human papillomavirus. There's one type of pneumococcal pneumonia vaccine that contains 23 different strains, so it is a 23-valent vaccine. Now we'll talk about single versus combined vaccines. Now, a combined vaccine is several vaccines often combined into a single dose in order to avoid getting multiple injections. An example of this would be MMR2, which is a vaccine for measles, mumps, and rubella. Another example of a combined vaccine would be Proquad, which is measles, mumps, rubella, and varicella. Another trait about vaccines is that many will need a booster shot. This is a second, third, or even fourth vaccine that follows the initial one received by the patient. And this is used to boost the immune response to the disease after some time has passed. A common example is every adult should receive a tetanus vaccine booster every 10 years, regardless if they've been exposed to it or not, just to maintain the high level of immunity against the disease. Now we'll mention a drug alert about how some vaccines are prepared. Egg allergies is the second most common allergy in children. The influenza vaccine and the MMR vaccine, given as a part of childhood immunizations, are made using chick embryos and do contain egg proteins in vaccines. Now, some vaccines contain more egg protein than others. Children and adults who have a severe allergy to eggs should not be given these vaccines. Now, others in the household who are not allergic to these vaccines should receive them, so they cannot transmit the disease to an unvaccinated child. The Asthma and Allergy Foundation of America states that most children will outgrow their egg allergy by age 5. Now I'll talk a little bit more in depth about how vaccines are prepared. According to the CDC, vaccines also contain small or trace amounts of chemicals or other ingredients. Some of these include aluminum, and it's there to help stimulate a better immune response. Could be antibiotic drugs. These prevent the growth of bacteria in a multi-dose vial. Disinfectants. These prevent the growth of bacteria and viruses. Stabilizers. These are there to resist the deteriorating effects of heat and light. Formaldehyde, which will inactivate bacterial toxins as a vaccine is being produced. Albumin and egg proteins. These are found in influenza vaccines that are prepared using chicken eggs. Another component is thimerosal, which is a mercury-containing preservative. Now, this keeps the vaccine from losing its potency over time. Now, this preservative, thimerosal, is a mercury-containing compound, and it's 50% of mercury by weight. According to the FDA, it has been used since the 1930s as a preservative in many vaccines that did not contain live viruses. In the 1970s, widespread mercury poisoning from fungicide-treated seed grains produced neurologic damage in children but not adults. And this mercury poisoning was from methylmercury, not thimerosal. And it's this event that raised the issue of safety of thimerosal in vaccines. In 1997, the FDA reviewed the use of thimerosal in vaccines for children and found that some vaccines could expose a child to a level of mercury that exceeded the recommended limit. So the Public Health Service, FDA, CDC, and the NIH recommended that thimerosal be removed from pediatric vaccines. In 2001, the IOM, Institute of Medicine, reviewed the potential link between thimerosal and neurodevelopment disorders, such as ADHD, speech delays, and between the measles, mumps, rubella vaccine and autism. Worldwide rates of autism increased in the 1980s and 1990s, but the IOM's research was inconclusive. No direct causal relationship was found, because exposure to thimerosal-containing vaccines was decreasing. The IOM did recommend removing thimerosal from vaccines as a public health goal. According to a 2014 CDC vaccine fact sheet, pediatric vaccines manufactured in the U.S. contain no thimerosal or only trace amounts. An exception to this is the inactivated influenza virus. Now we'll move on to immune globulin drugs. Now, these are drugs that are made by processing human blood plasma and extracting the antibodies, immunoglobulins. Now, these are given to patients to provide a short-term temporary protection against a disease after the patient has been exposed to that disease and does not yet have their own antibodies. Some examples of this would include varicella and rabies. Alright, now we'll get into the process of immunization. Immunization inserts a vaccine into the body. This is also known as vaccination or inoculation. There are multiple routes of administration for immunization. When using the oral route of administration, this is really only good for adenovirus and rotavirus. Most vaccines can't be given through this route because they're not absorbed from the intestine. Another route could be the intranasal route. And this is one type of immunization for influenza. So another possible route of administration is the subcutaneous route. And some examples for this would include measles, mumps, rubella, varicella, and herpes zoster. Another route of administration is the intramuscular route, and all other vaccines are given by this route. All right, now we'll talk about diseases that are prevented by vaccine. Although the body's immune response is largely sufficient to prevent a widespread infection, sometimes a pathogen is present in such a high concentration that it overwhelms the body's defenses, or the pathogen is so particularly virulent that it is able to multiply rapidly within the body. Okay, if that's the case, then you end up with certain conditions. One is an epidemic. This is a bacterial or viral disease that causes a sudden, unexpected outbreak among many people. And if that continues to get worse, then you have a pandemic, which is a bacterial or viral disease that has spread throughout an entire region, country, or the world. Now, vaccines were developed because some diseases were highly contagious and posed a public health threat. Their symptoms were severe, or the disease could cause a permanent disability or even death. And the World Health Organization attests that vaccines are currently available to prevent 25 diseases, and we'll go over some of those here next. One example, adenovirus. This can cause severe epidemics of respiratory illness, and this is only approved for use of the military. And this is given to recruits who enter basic training. And this is given orally in the form of 2 tablets that are taken at the same time, and these contain adenovirus type 4 and also type 7 vaccines. See, anthrax. This is a bacterial respiratory disease that is often fatal, and it is spread by spores that can be transmitted by food or by touching infected animals or clothing. And the first vaccine for anthrax was developed by Louis Pasteur in 1881. Now, terrorist attacks using powdered anthrax as a biological weapon has renewed the interest in the vaccine. This is given to some military personnel and persons who handle animals and animal products. And this kind of vaccine will be given through an intramuscular injection, and commonly known by its trade name, Biothrax. This is another disease that's prevented by a vaccine, diphtheria. This is a bacterial respiratory disease that is highly contagious. It can cause a high fever and creates a gray membrane in the throat that can cause suffocation. It can also lead to heart damage and nerve damage. And before the vaccine was created, it caused 200,000 deaths each year in the United States. The vaccine for diphtheria is given to infants in 4 doses between the ages of 2 months and 18 months. And this is often included with the tetanus and pertussis vaccine. This vaccine is given through an intramuscular injection, and is more commonly referenced as DTaP, diphtheria, tetanus, and pertussis. And the trade names for this vaccine include Adacel and Boostrix. Another example of a disease that's prevented by vaccine, Haemophilus influenza type B, often referenced as the Hib vaccine. This is a bacterium that causes severe pneumonia and meningitis in young children. The vaccine is given to infants in 4 doses between the ages of 2 months and 15 months. This is another intramuscular injection, and the brand name that is known under is Pedvax Hib. The hepatitis A is caused by the hepatitis A virus, or HAV, and exposure to food or water that contains the virus because it is contaminated with the feces of an already infected person. Now, hepatitis A is often acute and short-lived, and most patients will recover completely. Now, the vaccine for hepatitis A is given to all children in 2 doses between the ages of 12 months and 23 months, then a booster about a year or to a year and a half after that. And the vaccine contains an inactivated virus that's given through an intramuscular injection. And the trade names that this vaccine is sold under Havrix and Vacta. Hepatitis B, caused by HBV, hepatitis B virus, and also exposure to blood, saliva, or vaginal secretions of an infected person. This is also an acute infection. Most patients will recover completely, but some patients will experience chronic and asymptomatic infections. The vaccine for hepatitis B, given between the ages of 1 month and 2 months, and it's followed by a booster between the ages of 6 months to 18 months. And this is also given by an intramuscular injection. There are 2 forms of this vaccine. You have the hepatitis B vaccine, known by the trade names Ingerix B and Recombavax HB. This is the vaccine that's given to healthcare workers prior to their employment. Another kind of vaccine here would be the hepatitis B immunoglobulin, also known by the trade names Hepagam B. And this is given after someone has been exposed to the virus, such as a healthcare worker being stuck by a used needle, or babies who are born to women who have hepatitis B. Herpes zoster is caused by the varicella zoster virus, and it's the virus that causes chickenpox in childhood. Now, after a patient recovers from chickenpox, the virus will remain dormant until triggered and reactivated by stress, illness, or medicines. And when it does get reactivated, it will form clusters of painful vesicles on the skin that follow the pathways of peripheral nerves. And at this point, this is called shingles. So the herpes zoster vaccine is a shingles vaccine given to people who are 50 years of age and older who have had chickenpox in childhood and who are at risk for developing shingles. And this is a subcutaneous injection. It's also known by the trade name Zostavax. HPV, human papillomavirus. This is a virus that is common in nearly all sexually active adults. There are more than 40 different strains of HPV that can cause genital warts. This can also cause cervical cancer in women. It can also cause throat cancer in a person who has had oral sex with an infected partner. Now, this vaccine is recommended for girls and boys between the ages of 9 to 26, and it's given in 3 doses via a intramuscular injection. There are 2 types of HPV vaccines. The trade name Cervarix is a bivalent vaccine, contains the type 16 and 18, and then Gardasil, which we mentioned earlier, is a quadrivalent vaccine, and it contains strains number 6, 11, 16, and 18. Influenza, viral respiratory disease that is particularly contagious. There are 3 types, A, B, and C, and types A and B cause the most severe illness. And the CDC recommends annual immunizations beginning at 6 months of age and continuing throughout a person's life. Now, the vaccine type that's given is based on the patient's age, whether the patient is pregnant, and whether or not they are allergic to eggs. Some examples of the influenza vaccine include Fluzone high dose, and this is recommended for people who are 65 years old and older. And this contains 4 times the number of inactivated viruses. The most common route of administration for a influenza vaccine is an intramuscular route, and the vaccine Fluzone intradermal can be given intradermally. Flu mist can be given by a nasal spray, but by far the most common route would be intramuscular. And some examples of trade names for influenza type A and type B vaccine include Fluarix, Flublock, Flumist, Fluvarin, and Fluzone. Now, in February of each year, the CDC selects those strains of influenza that are the most prevalent throughout Asia and other parts of the world to be included in the flu vaccine that will be offered in the United States in the following fall, before the start of the flu season. Flu viruses will mutate constantly, and so the influenza vaccine must be reformulated each year. And people who get flu shots can still become infected with strains of influenza that aren't included in that year's flu vaccine. A historical note about influenza. In 1918, a worldwide influenza epidemic killed 50 million people. The virus was very virulent, and some patients died within hours of being infected. In the United States, over 20% of the population was infected, and because of a high death rate, the average lifespan of Americans subsequently decreased by 12 years. Avian influenza, or bird flu, affects chickens, turkeys, and ducks, but can be transmitted to humans. Of the 16 different strains, the H5N1 is the most virulent. And this occurs in Asia and in the Middle East, and is fatal approximately 60% of the time. In 2009, a new strain of the influenza virus caused a worldwide pandemic. This was H1N1. This was known as swine flu because it came from infected pigs. It contained genes from the flu virus that had infected pigs in Europe and in Asia, but also contained genes from bird flu viruses. The number of cases of flu, mostly in children, increased dramatically in the summer when county and state fairs had farm exhibits that contained petting zoos, and those petting zoos had pigs. Now, concerns about a possible epidemic and deaths from H1N1 led to a massive public vaccination program in the United States. Some other examples of diseases that have been prevented by vaccines. Measles. This is also known by the name rubella. And it's often thought of as a mild childhood disease with a rash, but this is actually very highly contagious and caused by a virus. And measles is spread by coughing, and a person can become infected just by breathing the air where someone with measles had coughed 2 hours before then. And some common symptoms of measles: high fever, a hacking cough, and a red rash. In the 1950s, measles caused 48,000 hospitalizations each year, 7,000 seizures, and 500 deaths. The vaccine for measles is in combination with a vaccine for mumps and rubella. And this is given between the ages of 12 months to 15 months, and then again between the ages of 4 and 6. And this is given through a subcutaneous injection. So this combination vaccine is measles, mumps, and rubella, MMR2, also known as Proquad. Another example of a disease that's been prevented by a vaccine: meningococcal meningitis. This is caused by the bacterium Neisseria meningitidis. This can cause inflammation of the brain and of the spinal cord. It can lead to deafness, kidney damage, nervous system damage, and eventually death. Now, this can even kill a child in less than 24 hours. Now, the vaccine for this condition is given to adolescents between the ages of 11 and 12, and then a booster at the age of 16. It's also recommended for college freshmen who are living in dormitories on campus. And persons who are older than 55 are given a different type of vaccine for this condition, and it's called Monomune. And this vaccine is a intramuscular injection, and some trade names that this is sold under Menactra, Menomune, and Menvio. Another condition is mumps, a very contagious disease that causes swelling of the salivary glands. This is spread by coughing and can cause inflammation of the brain, deafness, and can lead to swelling of the testicles in boys. The vaccine for mumps is given between the ages of 12 to 15 months, and then again at the ages between 4 and 6. This is given in combination with the measles and rubella vaccine. So this is a part of the MMR vaccine. It's also known as MMR2 or Proquad. And this is given through a subcutaneous injection. Another condition, pertussis, is also known as whooping cough. Now, this cough has a very characteristic choking sound that's made from the spasms of the voice box. Now, this disease can cause respiratory distress and severe coughing, and half of unvaccinated babies who contract it require hospitalization. The vaccine for pertussis is given in 4 doses between the ages of 2 months and 18 months. And this is included with the diphtheria and tetanus vaccines. And pregnant women are advised to obtain it for themselves during the 3rd trimester of their pregnancy. And this is given through an intramuscular injection. And so this vaccine, the DTaP, is also known by its trade names Adacel and Boostrix. So another condition, pneumococcal pneumonia. This is caused by the bacterium Streptococcus pneumoniae. This is spread by droplets within the air. This is the leading cause of respiratory illness in the world. This can lead to pneumonia, meningitis, sinusitis, and otitis, especially in children under the age of 5. Now, the vaccine for pneumococcal pneumonia is different depending on if it's an adult or if it's a child. For children, they would be given a pneumococcal conjugate vaccine, or PCV13, because it produces a longer-lasting immune response. And this is given as 4 doses between the ages of 2 months and 15 months. For adults, if they are aged 50 or older, they should receive pneumococcal polysaccharide vaccine, or PPSV23, particularly if they live in a long-term healthcare facility. And some trend names that you could find this vaccine under for PVC13 would be Prevnar 13, and for PPSV23, Pneumovax 23. Another condition, polio, also known as poliomyelitis. This is a viral disease of the spinal cord that can cause weakness of the muscles, paralysis, the inability to breathe, and eventually death. This is spread by infected persons through feces and contaminated water and food. Now, in the past, those who were infected and were unable to use their paralyzed breathing muscles spent the rest of their life in an iron lung that would breathe for them. But even in recovery, some people were left with partial paralysis. And the vaccine for polio is 4 doses of a killed inactivated poliovirus, or IPV, that's given between the ages of 2 months to 4 years of age. This can be given either in a subcutaneous route or intramuscular injection. And the brand name this would be sold under would be IPOL. A historical note about polio. In 1921, at the age of 39, Franklin Roosevelt was on vacation when, after some strenuous exercise and swimming in cold water, he developed a fever and paralysis from polio. And he was partially paralyzed from the waist down for the rest of his life. And of course, he went on to become the 32nd President of the United States from 1933 until his death in 1945, and was active in founding the March of Dimes Foundation. Now, he concealed this paralysis from the public because of societal views of the handicapped at the time. Reporters usually would photograph him in a sitting position, and his leg braces were never shown. When he was photographed standing up, he used his arms on the table in front of him to support himself. The last polio epidemic in the U.S. occurred in the early 1950s, causing widespread fear as mothers kept their children home from school. In 1955, Dr. Jonas Salk developed the first polio vaccine. Millions of American children were vaccinated in the upper arm, leaving a unique large round scar. Then in 1961, Dr. Albert Sabin developed a vaccine from attenuated poliovirus, or a weakened poliovirus, that was given orally on a sugar cube. Now, the Sabin vaccine used a live attenuated virus, and occasionally it would mutate and would cause paralysis. So currently, polio vaccines only use inactivated or killed viruses. Some other examples of diseases that have been prevented by vaccines is rabies. This is a viral disease that's carried by dogs and cats, bats, and other mammals. This is transmitted by saliva in the animal's bite. Now, the virus will cause inflammation of the brain and spinal cord with seizures. Now, this is fatal to humans and animals. And the vaccine is given for veterinarians, anyone who works with animals, and those who travel. About 18,000 people in the U.S. are given the rabies immunoglobulin drug to provide a temporary immunity following a bite from an animal that is suspected to be rabid. Now, the rabies immunoglobulin vaccine, also known by its brand names Hyperrab SD and also Imagam Rabies HT. This is a subcutaneous or intramuscular injection around the area where the person was bitten by the animal. And the regular rabies vaccine, its trade names include Imavax and Rabivert, and this is an intramuscular injection. Another disease is rotavirus. This is a viral illness that causes fever, vomiting, and severe diarrhea. And it's highly contagious, and about 500,000 children worldwide die from it yearly. And the vaccine for rotavirus was first available in 2006, and it's given at 3 doses at 2, 3, and 4 months of age. And this is given orally as a liquid. And the trade names that this vaccine could be found under Rotarix and Rotatec. Another condition is rubella, also known as the German measles. This is contracted by air droplets from someone coughing. This is a relatively mild upper respiratory infection, but can cause birth defects in the fetus if a pregnant mother gets infected, and it can lead to a miscarriage in 20% of pregnancies. Now, the vaccine for rubella is given between the ages of 12 to 15 months, and then again between the ages of 4 and 6. It's a subcutaneous injection, and this is a part of the MMR vaccine, measles, mumps, and rubella vaccine. So the trade names, this could be found under Proquad and then MMR2. Tetanus, also known as lockjaw. This is caused by the bacterium Clostridium tetani. And the bacterium will produce toxins that will cause muscle spasms, almost painful muscle spasms, and will lead to difficulty in breathing, difficulty swallowing, and eventually death. And these spores will be found in soil and in dust and in manure. And bacteria will enter the body through a skin wound, such as when a person steps on a rusty nail, for example. And the vaccine for tetanus is given as 4 doses between the ages of 2 months and 18 months. And this is a part of the diphtheria and pertussis vaccine. And this is an intramuscular injection, and this is the T part in the deep tap vaccine. So diphtheria, tetanus, and pertussis. And again, its trade names will be Boostrix and Adacil. And the last disease that we'll talk about that's been prevented by a vaccine is varicella. It's also known as chickenpox. Now, this causes a fever and an itchy rash with blisters. And this is caused by the varicella zoster virus. It's very contagious and spread by coughing, sneezing, sharing food, or touching the fluid from a skin blister. The vaccine for varicella is given to children between the ages of 12 and 15 months, and it's given through a subcutaneous injection. And the trade name this would be found under would be Varivax. All right, now we'll talk about some other vaccines. First one we'll talk about is human immunodeficiency virus, or HIV. In 1988, the National Institute of Health began efforts to develop a vaccine to prevent HIV and AIDS. A vaccine for HIV is difficult to develop because HIV is a complex virus that mutates often. Much research is still being conducted because this disease is a serious public health issue. About 50,000 Americans and about 2.3 million people throughout the world become HIV positive each year. A cancer vaccine. The only existing vaccine is designed to treat, not prevent, male patients who already have cancer of the prostate gland. The name of that vaccine is Sipuleucel T, also known by its brand name of Provenge. This is an autologous cellular immunotherapy drug, and it's created by collecting 50 million of the cancer patient's own lymphocytes and combining them with a protein that is similar to the antigen on the cell membrane of the prostate cancer cells. Now, this is given intravenously in 3 doses that are several weeks apart, and this costs about $93,000. And it extends the lifespan of the patient with advanced prostate cancer for about 4 months. Now we'll talk about childhood and adult immunization schedules. The recommended immunization schedules are published by the CDC, Centers for Disease Control and Prevention. This is in collaboration with the American Academy of Pediatrics and the American Academy of Family Physicians. This image is probably the simplest form you're going to see of a immunization schedule published by the CDC. And this is for children between newborn and 6 years old. You can see the timeline up here on top, all the way up to 4 to 6-year-old range. And then the abbreviation for each vaccine is listed here at the appropriate time where it should be given. And this image is a little bit more detailed, more of a professional schedule. And this covers ages from birth to 18 years of age. Again, the timelines up here on top, the various vaccines here on the left, and the various time frames which they should be given. And on this, you also see a different variety of colors, and this indicate when the time frame is appropriate to give that vaccine, and then when it's a little bit too late but it's able to be caught up on, and then when it's too late. And some colors will indicate what's recommended for a high-risk patient when they should be given certain vaccines. Okay, now this chart is a immunization schedule for an adult. So we see the time frame here on top, starting at age 19, going up to 65 years of age. Various vaccines here on the left, and when it is appropriate to give each vaccine and in how many doses. Most vaccine preventable diseases have been nearly controlled because vaccines are 90 to 99% effective. However, a vaccinated child can still occasionally get the disease. Now, there are only a few cases each year, but they are usually mild ones. Unvaccinated children become ill more easily because those bacteria and viruses still exist in the environment. Also, travelers from other countries where the disease outbreaks can bring the disease to the United States. And without vaccination, the disease can be severe and sometimes fatal. So vaccinations are a critical part of your health, both for you as an adult and your child. So it is important that these are kept up to date. And that brings us to the end of this chapter. We will continue our video series on pharmacology with our next video on chapter number 24, anesthetic drugs.